now it kind of leaves us where we were before. What do you want to do in terms of treating the brain, or
I just want to leave it like it is.
leave what like it is?
My brain, what little I got.
Well, it's all there, I promise you.
Yeah.
Okay. But not do anything with it?
That's
So
what I
did you
guess.
talk with everybody about
I
this?
have.
Yeah, because I know.
Well, I just told her, I said, why don't you come today and ask any other questions you might
Okay.
have, and
yeah,
about
so,
how it would make her feel,
Yeah,
or
are
what
you-
it would, you know.
so are you
I
having
feel
any?
so good, I don't want to feel
I
bad.
think that's
Yeah.
it, she's feeling
I
good.
mean, I do, I really feel good.
Okay, so no headaches, nausea,
Nothing.
vomiting, nothing
Nothing.
like that. No vision changes. No, all that's good.
I'm blind in one eye and can't see out the other one,
Okay, but that's been that way for a while, like with cataracts, right?
but that's what I'd like to get
Yeah.
done.
But
I
yeah,
like to see good.
how about
Everybody-
pain in the shoulder?
No, it doesn't.
She
You
hasn't
normally
really,
tell the
she has,
truth,
I
yeah.
know, I mean, she really hasn't complained about her shoulder
Yeah,
lately.
okay.
If she behaves,
If
she does
anything-
do something, it's fine.
If
Yeah.
anything, she's complained about her hip, and I haven't even heard her say that much
I
lately.
think that was less activity. I think I
Okay.
just needed to move
Okay.
more,
Okay.
and that's
Alright.
what made my bad.
Okay.
If you don't use it, you lose it.
Yes,
Yeah.
yeah.
And you've been off of chemotherapy since like this kind of started.
Mhm.
What were your thoughts with going back on the chemotherapy? Because
I
I know
haven't
you,
thought about
since
that.
we've seen each other last, we've had a lot of things happen.
Yeah.
The lumbar puncture,
Yeah.
meeting with palliative care, all of that's kind of happened. And I know.
I've seen her on good days say one thing, and on bad days say another thing, and like today, she's saying one thing, so I'm sure she's struggling. She's been
Yeah.
really struggling with what she wants to do, so I told her we would just come in here and be quiet
Talk.
and let her, and we would even leave if she wanted to.
Okay. So the big thing that I worry about is when you start to have symptoms, it's hard to get them to go away. Okay? Oftentimes that's kind of too late. So this is the areas that we're seeing. Oh, you don't like to see it. Yeah. But they're relatively small. So I think that's why you're still feeling good, even though we see it. Okay? So that would be the reason to do it now.
To knock it back.
To get rid of what's there.
But it can come back though. So.
It could come back, okay, so those areas, most of them tend to respond, okay, and then what could happen is we could get new spots in the future, but who knows how long that would be, okay? And whether we would continue chemotherapy or not. The worry with the chemotherapy I have is it may address everything here, but it won't get into the brain, okay? So those areas would continue to grow. So to me, I don't know if it necessarily makes sense to not do the radiation, but then to keep doing the chemotherapy.
That's what I told her.
Okay? I think it.
How about giving it all up?
Well, that's
Well,
your
no,
choice,
and I
but
think that's it's an option
I know it
for
is.
you. Okay, and then what?
Don't give me options.
Yeah. Well, no, and I think if that's what you want to do, I think it's perfectly reasonable, knowing we're not going to be able to cure this. Okay, and kind of how you've looked at what treatments you want to have. Since I've known you for about 2 years now, that would be perfectly in line with kind of how you've gone through treatment. Okay, so I don't think that's an unreasonable decision.
Right.
And I think if you want to do that part, then it would be to go back to hospice and talk with them and say, well, make sure that they're going to be following with you, and when you need more
When we need 'em,
information,
then we use
yeah,
'em. Right.
but
We only
to
use 'em
talk
when
with
we
them.
need 'em.
Yeah, and I think that's where, if you're gonna do that, that's why I wanted you to meet with that palliative care team
Okay.
to talk.
Which we did.
I'm
So it sounds like what you're saying is that if she's not gonna do the radiation and she's gonna, it doesn't make sense to continue treatment for chemo, but if you're gonna, did I say it right? Did I say it right?
I just, because
Right.
typically that chemo doesn't get into the
So this is
brain.
gonna continue to grow.
And even though you'd be having potentially the chemo affect everything else, I just don't think it would make, and you could
Right.
talk
Yeah.
to Dr. Mackler
So
too
in other
about
words, you either want to treat all of your body
I think it would
or
be,
none of your body.
Yeah,
Which
I think
makes
it would be
sense.
more like, do we want to continue with cancer-directed therapies or is this the point where you say,
Right.
kind of, I don't want to do anymore. I
So
wanna
that makes
just-
sense, you wouldn't wanna do chemo and not radiation,
I don't
Yeah.
agree
or
with that.
radiation and not chemo,
Yeah.
right?
Yeah.
Yeah.
So that's what he's saying,
And
which,
actually, and I think even doing like radiation and then not chemo would make more sense to me, because it would be, try to get the brain under
Right.
control so it wouldn't cause any problems, and then
Right.
say, well,
they would
let's
keep you
stop
more
that.
neurologically intact.
Yeah, to avoid any complications from that down the
Did
road.
you hear what he said about that just now? Just wanna make sure you
Yeah.
heard what he said.
'Cause
He's
I
He
saying,
think-
did sure and went out
I
that
know.
one and went
I
down.
know, but
Yeah.
he's saying.
I think she made up her
I
mind
know,
already.
I know she does,
Yeah.
but I didn't know if, I had never thought of doing just radiation,
Yeah.
not chemo.
Well, and I think with that, it's because having neurologic
Having your
progression
brain and having
can
your.
cause-
Good
I mean, right
sensory.
now you're not having any symptoms, but if you start to have symptoms from that before like the systemic disease may progress, then that can cause a lot of problems quickly, okay? So you could go from feeling well
Right.
to not. Not saying that having the disease progress in the rest of the body
So
So
is
she's
do that.
thinking radiation's gonna make her sick. So she's
So
thinking.
I don't
different.
expect it to make you sick. It can cause some tiredness, okay? The hair, that will.
What hair?
Is there?
This won't come out.
No, there's no
Oh,
hair.
no. Oh, I thought you had some grow back.
Are you kidding? I
No?
wish.
Okay.
It's coming back some though, but.
Yeah, I thought it was, so the hair would go away. Some of the skin redness, I don't expect it to be how it was here, but the skin on the scalp, that could get irritated. When we talk like that fatigue, most times once we finish, the energy level comes back up. You may not feel as like energetic as you do now,
Was it
but
2 months?
yeah,
Could
over the
take 2
couple
months.
months after, okay? But what I worry is if the cancer progresses in the brain, that can make you feel tired too.
Would it make
So-
you as
So
tired
he's
as
saying you're gonna be
chemo?
tired with radiation, or if the cancer
Potentially.
gets worse, that's gonna make you
You're gonna be
tired too.
tired
Yeah.
anyway, yeah.
I'll
Yeah.
just give
That
you,
makes
uh,
sense, though.
So,
You're
and
gonna be tired
I
anyways.
mean, the big concern with radiation is that memory, okay? So having injury to the memory structures,
And
the
God, I've
normal
got good
brain.
I got such good memory, I
But-
think I wanna hang on to it.
But
as
that
long
could
as
go
I-
too.
Well, and with radiation, most people, so it's over half, see like their short-term memory get worse when they measure it out. We measure it out a couple months.
Short term, things you
Yeah.
just learned,
Like
things
your
not your old
family,
time.
all of that. I
You
don't
get all that
expect you.
anyway.
So, but like I would expect you to remember that. It's just going and walking to the other room. You have a higher chance of walking and saying, "Oh, what I come in
Well,
here
sometimes
for."
I go in the bedroom to get something, I forgot what.
So you're doing that now.
I've done that 50
Or
years.
what you wore
Everybody
last
has.
week, yeah.
Mhm.
That's when you got too many hands on fire.
Yeah.
But
But-
not good memory.
And if I would give you a list of 5 things, that may be kind of harder to keep track of.
Could it make her go blind?
Huh? I wouldn't expect that.
Cause she
okay?
had mentioned that today, and I just wanted to
You mean
clarify
blinders.
that
So
with her.
the radiation to make someone go blind would be incredibly rare. Okay, so it can cause cataracts that are different than the cataracts that you have
Yeah.
now, but those develop years down the road. Okay,
Yeah.
I would worry more if we were doing, because that area on the optic nerve.
Yeah.
Okay, so that could potentially cause problems in
Well,
the
they're
future.
gonna be
Leaving
doing
it.
all
Yeah,
that,
well,
though.
leaving it.
Leaving it and not treating
Treating.
that
Oh, I
could
thought,
cause
but
it.
I thought you said when you if you had to radiate
with
that.
the with the
it could make her go
stereotactic
blind.
with the stereotactic radiation.
That
When
was
this was the
targeted.
only
Straight
thing.
on,
This would
okay.
be that 2-week
So this would-
radiation.
as-
Yeah, that
okay.
the risk of that would be incredible.
Okay.
That was
So
Yeah.
that's important to know, cause I
So-
know you'd mentioned that.
And then,
He's
I mean,
saying
the
that-
other thing with so just kind of looking back historically, okay, on kind of the numbers that we use
Right.
to kind of gauge brain metastases, and a lot of it back where this came from, they didn't have as good an MRI, so they were missing things
Sure.
that you can't see on CTs, and so if we do nothing, when just would treat with steroids, survival's in the month range, which I mean we've known about this for longer
Right.
than that. So I think, but then adding just like symptomatic treatment kind of with steroids improves the survival by about
Let me just
2.
make sure I heard what
And
you
then-
just said. Did you say if she doesn't get radiation,
Within a month?
Well, so, but we're over that month, and I'm saying this more to give kind of, I would expect radiation to slow down this process and increase the chances kind of for lengthening survival. okay? So there is that part to it.
Yes.
That, I think, the months terms, because we've had these areas
Yes, we
and they
have.
haven't really
Yes,
changed
yes.
over a period of several months, so I think some of it is just what we're able to detect now.
I just wanna make sure I hear you right. So
But-
you're saying that if she doesn't get radiation to the brain,
I
it
think-
would be well under a year.
Yeah.
Well under a year for survival
That's
rate.
that's what I would expect, okay?
Okay, it's-
I
And
just wanna
even-
make sure you knew
Even
that.
with radiation to the brain, I would expect less than a year survival.
Okay.
But if she
Okay.
did,
But I
how
think
long?
it would, it's impossible
I mean,
to say.
guessing, like,
I would think
to
it would
add
be
5 months,
longer.
month.
If we would stop everything, we're probably looking around months, okay, just
Right.
with how you are now.
That's okay, I'm ready to go.
But-
Look at her, she's
but-
so,
I am,
you're
I'm
so
not-
positive,
Yeah.
that's great.
I'm at peace.
That's great, that's
Yeah.
great.
I really
Yeah.
am
And I
at
think
peace.
that's where, if you know that you don't wanna do any of this, I don't wanna force you
I
into
know.
it.
You can't anyway.
Yeah.
You can't teach old dog new
What if-
tricks.
Yeah,
No,
and I know we were,
I am at peace with everything.
yeah,
But you had mentioned the brain, by doing this, could keep her functioning longer
so.
mentally up here.
It's gonna
Potentially.
make some difference,
Yeah.
but not a big, not,
Because this, I mean, these areas we're seeing now
You
are
know
small.
No,
There's,
care, yeah.
there's
I'm
multiple,
almost-
but they're small, okay?
listen, I'm almost 80 years old.
Mhm.
And I'm not, I know I don't have that many years anyway, even if I had nothing wrong with me.
Mhm.
I've lived a long life. I've just had a good life. I've seen everything.
Yeah,
And I'm okay with everything.
well, and I think you don't wanna do the other things, is the thing.
I don't
And
wanna
that's
do
the
Well, it takes the
biggest,
quality of
I
life
don't
from
wanna
her.
do
She
nothing.
stays
Well-
in bed, she won't go nowhere. She
When
doesn't
she's
feel
getting
like doing
treatments.
nothing. It's no quality life for
Yeah.
No,
her.
I'm comfortable.
That's what I said.
I'm
No, I
comfortable.
said when you're going through treatment, it just
Oh.
takes so much out of you don't wanna do nothing, you're tired,
Well,
and, you
that's
know.
okay. I got over all that. I
Yeah.
don't worry about that. But I'm just okay with life right
Feels
now.
Yeah.
good, you know, right now.
But I don't wanna live the rest of my days miserable with treatments and going and doing. I
Yeah.
just want to live
yeah,
comfortable
well,
as
and,
I can.
yeah.
And then if something takes hold of me that I'm not, then that's
Mhm.
okay too. That's what I have to live with.
Okay.
I'll get me a bottle of liquor. I'll get
She
a
said
bottle.
It's not real liquor, I don't
And
think
she lies so
yeah.
bad, I
She
can't
said
even get her to have a beer
yeah.
the other day.
Yeah,
She said she's
No.
going on a cruise.
No, that's just kidding. But I'm just comfortable.
But 2 weeks of radiation
so
could
the-
make her quality of life
So
better
in
in
the
the long run.
it's in the
was-
short term where you get that kind of sacrifice.
No, it's gonna
Right.
set me back a little
And
bit. I don't want that.
The long term is having some of the memory issues, but
It helps
what
me and
we're
it don't.
Right, you're
yeah,
paying the
and
price.
right
but what
now-
we're
Pay
trying
the
to,
price for
and
it.
I think it's, I mean,
I understand, but I
Let's
don't
hear what
Yeah.
he says, what's
so
he
I think
saying?
it, I mean, in terms of, if you said, tell me what to do, let's do the radiation, and then we can decide on chemo depending on what you want.
Yeah.
But I mean, knowing it's not curative, that's where your thoughts come into it.
Yeah.
The short term is the inconvenience, the fatigue, hair loss, okay, those,
I'm
the
not worried
fatigue
about
tends
that.
to get better after a couple months, it can linger around.
See, a lot of
The-
people, they have radiation and it cures the cancer, it takes care of it, and then they end up somewhere else.
Well, we know the cancer's other places, like, we know
All
that,
over.
and
I
that's
know
where the
Janice's mother.
chemotherapy comes in.
Right, exactly.
So,
Janice's mother had
this
a
would
big
be
tumor in her brain,
only to
and they healed it,
get these areas to stop growing so they can't cause problems.
and then she
Okay.
ended
She's
up.
trying to tell you
in,
something.
I heard her.
Okay.
Yeah.
She's talking about somebody else though.
No, I know you can't compare, but
Right.
I'm just saying, it's in my body
Mhm.
but
It's no
Oh.
guarantee.
I believe in miracles too.
Yeah. So, well, for miracles, try treatment, is that what you're saying, or?
No,
No,
God.
No.
that's one miracle, but there's another, and he's above. I'm very strong in believer,
Good.
and that's what helps me get through everything.
Good. And you have a priest or
Ah,
chaplain.
God,
or-
he's in my home, he's everywhere I go. That man don't get me to heaven, that
Yeah.
preacher.
So,
That's between me and the Lord, that's an individual thing.
just to throw it out there,
Mhm.
what do you recommend?
So
He's a
it's
radiation
really
doctor.
I
So-
know,
Let him talk.
but
Well,
now that
so
he's, now
I
that
think there's-
he's heard your concern and your thoughts and your feelings,
So I think
What
we
do you think?
haven't ruled out 100% that it's not in the fluid. I mean, it doesn't look like it. Having the brain metastases, the best thing we have to treat this is whole brain radiation. Okay, so that's the recommendation. That's what I was getting to earlier, to do that. But knowing it's not curative,
I
and
mean,
knowing how she's looked at her treatment and the course with her cancer, even from before when it wasn't metastatic, you've always been kind of resistant to doing treatments, okay? And I think if we've come to this point now,
No,
and that's what
I
you're-
never resisted chemo, I never did I?
It's
Did
all
I?
right,
I don't
Mom.
know.
I mean, I
No,
it's
but
okay. I
even
mean,
with
it's,
like
it's
the
scary
past,
stuff.
the radiation in the past to the
Yeah,
chest
yeah,
wall.
yeah.
I
I
know.
mean, they drove me crazy with it
Yeah.
more than I did.
We were always just like, give it a shot,
Well,
see
and
how
I
you
think
do, and you
we
know.
were, I mean, that was kind of those same recommendations.
steps,
This
right.
is the best shot we have to kind of reduce it from coming back, okay?
I mean, I understand that all these treatments and that has come a long ways, cause back
Mhm.
years ago,
Well,
they
and,
didn't have nothing.
and even now when we have to treat the whole brain, it's very similar to what we've done over the years,
Yeah.
okay? But with the spots that are there kind of scattered throughout,
Mhm.
it's the best way to do it, okay? I think that's cancer-wise the best thing to do, okay?
Yeah.
Now, if that's the right thing for you or not, that's kind of a different question, okay? And from what you're telling me, it's no, that's not.
Well, it's just not for my feelings, I just.
Well, and that's where I'm here to tell you kind of what radiation
Oh, I
is,
know, I understand.
what the goal of it is.
I
And how to
and-
make you feel.
Yeah, so
I
you can
understand.
make that best decision, and I think.
so the radiation would, the success rate of getting rid of the spots in the brain is very good with
So,
this radiation?
a lot of times it can shrink these. With the dose we're able to give the whole brain, getting that 100% doesn't happen, okay? And my worry more is not so much those ones that are there now, but even in the future having more come up, okay? Because that's something that definitely can happen.
And that's why she's frustrated with these treatments, is just
Yeah.
one thing after another.
It
Well,
doesn't
and
end.
that's.
Because it's incurable.
Yeah,
She has
and
an
that's,
incurable disease.
and that's with it now, and
So
that's
she would
exactly
have,
right.
she would have to decide, could this regimen, if she kept going, would it keep giving her good quality of life for many years?
Yeah.
And I don't even know if we have the opportunity of years.
To get years, yeah.
So I don't even know if we have the opportunity of years
And a
anymore.
lot of it is dependent on what systemic options are there.
Right, and if we don't have years, like if we can't say like, oh my gosh, she's probably gonna get 5 years if
Mhm.
she does this,
Yeah.
is it good, to even
Oops.
consider something that won't even give her a year?
Yeah, it's just so.
Yeah,
it's
You know,
well, and I
so-
think that's where we're more sitting.
Where we're
is
sitting.
like, we're not looking.
And we feel like
years
her-
in the best
and
case
she-
scenario. I mean, it can
Right.
happen, but I don't, that's
Right.
not what I would
And I think she
expect
was
the
afraid that
median.
the radiation would put her down too much, which would take away 2 months that she could feel good,
Yeah,
right? You wanna feel good as long as you can.
I'm okay right now.
So that you
Yeah,
probably
so-
encounter this with patients quite often,
Mhm.
that making that decision.
yeah,
Cause you're saying you're not gonna get years no matter what we do
no
here.
matter what we do. And
He don't
even,
know,
yeah,
that's between me and the Lord, he don't know.
Well,
and
As far
even
as
with.
He don't know.
Is what he's.
from
Yeah.
his experience
And
and
even
research.
with, like, once this was proven to be metastatic, most of the time we're looking at survivals less than a year.
Everybody's
okay?
days
And
is
with
numbered.
brain metastases,
And nobody
especially
really
when
knows
we
when
don't
you're gonna
have
go.
like
Right.
nitrogen receptors, things like
You're
that,
what he says.
we're looking at like
Just for
months
what he
to
can
like
offer, yeah.
months in
No,
6
nobody
months,
knows.
No,
give
I
or
know,
take.
but what
So
he, what he can offer
We're
is what
like-
we're talking about today.
there are certain scenarios where
Every day,
it's more or
body's days
less,
is
Yeah,
numbered.
yeah.
but we're
Oh,
looking
I know,
at really
religion-wise,
like
I know that.
in
I
the
mean, you
terms
could go
of
before
months.
me, you could
So,
go before me.
yeah, so if we're at like,
We don't know.
now how many months that is, I don't expect 1 month.
We
I mean,
don't know.
we've been watching this over a
Just
period
don't
of
know.
3 months.
Yeah.
I mean, this
But
could
now-
go on
now
longer.
we've got 3 months gone.
So
Yeah.
can I ask you how quick growing the brain cancers is and how
So-
soon we might notice affecting her?
That I don't know. Okay, so the area on
When
the
I
optic
start-
nerve we noticed in
When I start
July.
slapping you around
And
more.
Let him answer, Mom.
And then these areas, the areas we're talking about now, okay,
Mom said, "Quit
went
asking
from not being there in
questions."
July to being there in the end of September, okay? So they went from something we couldn't detect, so something
At
a
all.
couple of millimeters to
7
less
spots.
than a centimeter, but in multiple areas.
Multiple
So
areas.
at what point that would cause symptoms, it's hard to say, but.
But she
Yeah.
also has this going on, so something
Exactly,
could,
like in
it
the
could affect
shoulder
one of
and
the
the
organs
bones,
here, it could
yeah.
affect her liver, her lungs, or, I mean,
And
we
this
could
is-
have this before this, we don't know.
This is really just a treatment to keep this under control.
That's okay. I'm okay.
You're okay?
Yeah.
You're, you seem very certain about this, which is,
We don't like
I don't
doctors
care.
anyways. Do we, Mom?
I'm over it.
yeah.
People don't understand it's like a torture,
Do
you
you-
know, it just is.
When you met with the palliative care team, did they give you the information?
She did, and she told my mom, she said, I think you would do great on whole brain radiation.
Yeah.
She said, cause
Well, because that's
and we
the
asked
thing.
her, she said she had seen lots of people go through it, and
Mhm.
she said they've done well, but, well, again, mom told her, you know, I want good quality of life, I
Well,
don't
and that's
wanna,
where-
you
She
know.
don't see what she acts like
It's-
when
But
she
she,
gets
but
chemo
she
either.
was very positive about it.
Yeah,
They don't
and
see
Who was
now,
that?
The lady we met about palliative care,
Dana Barry.
Oh.
Yeah, so she's a good
Yeah.
candidate.
Well, and the best time to do it is when you don't have symptoms.
Right.
I think that's the key.
Yeah, catching it
Because
early for sure.
preventing symptoms is much easier than reversing symptoms.
Right.
Okay, so that's one of the like reasons on the why do it now and why do it at all. It's to.
let me ask you one question, not that she wants to, but if she did whole brain radiation,
Mhm.
how likely would it be? When would you do a follow-up to
I
her
normally
brain?
do it like 6
Oh, I'm
weeks
sorry.
after.
Me
Oh
too.
no,
Oh,
that's fine.
you, it sounds like mine.
Yeah.
6 weeks?
Yeah, like a
Okay.
follow-up MRI. I typically get one about 6 weeks after
Okay,
we
I didn't
finish.
know how long that would be in between that you would look.
Yeah, so it's normally 2 weeks of treatment. Then I
And
do
Yeah,
it.
you could do all
not
that,
saying you
month
want
later,
to,
come
when
back.
would you resume chemo?
So that's typically a week or so after we
Yeah,
would
we
finish.
talked about that.
Well, you guys,
And-
did
No.
you guys hear what
Yeah,
I
we
had to
did,
say?
we
I
did.
know.
We were just asking
I'm
her
just
questions.
curious
Yeah.
now.
I am over
So
it.
yeah, we typically
Yeah.
do this, the whole brain, and
Doesn't matter
then give
now,
a week
though.
or two off, and then resume chemotherapy.
And when would you have started it?
What?
The
whole-
radiation.
The whole brain? We could do it at any point.
Probably next
So
week.
yeah, like if we were gonna do it, if you said I wanna do it, we had an appointment to make the
The
mask
mask,
today.
I figured you did.
Yeah.
I said, I
So
bet
we could
he's,
do
I bet
that
he's.
today and then start later this week or early
But
next
that's
week.
okay, Mom, if you've decided, we're
No,
gonna,
I'm
we're gonna
over it.
respect that.
They're just
Yeah.
trying to make themselves
have
feel
to.
better, Mom.
No,
You
we're
have to.
not.
I mean, they
We're
want
making,
questions,
yeah,
you know.
yeah, we just wanted to
Yeah,
make sure
reassuring
that
for them.
you had all the questions answered that you wanted, so that you knew that you, cause sometimes you got things
Sure it
mixed
is.
up,
Sherry from the get-go.
I know,
so,
but no matter what all they do for me,
right.
I
Yes.
ain't gonna live
They
that
And
long.
we
always
knew,
said there ain't a
we've
cure.
always knew that though, we knew that from the
Right.
beginning, and you still chose to have treatment,
Well, you've been
so-
very
Yeah.
nice, so thank you for
Yeah.
Well,
Yeah,
the information you've given us.
Yeah.
and-
no offense to any of
No,
you guys,
never
everybody's
took
You've
treated
done
me,
offense.
good, and you've been a good group fighter, Mom.
everybody's
You really
treated
have.
me real nice.
You've been
But at
good
this
far.
point, I just want to,
She's pushed herself this
You
far.
want
I just
peace.
want
And I
to
think-
normal.
You want peace and,
I
You just
think
want
that's
peace,
reasonable.
right?
It's
Oh,
been
yeah.
with your way of thinking through the whole process. So I'm perfectly fine with that. I mean, I think we've talked about this a couple
If-
times now,
if she-
what radiation brings to the table and like what we're getting
Right.
versus what we're potentially giving up. How most people, I mean,
Mhm.
most people, I agree with Dana, she, like, most
See,
people
I went
feel
through
well.
all of
Yeah, they
that.
do, they
If-
feel well.
But if,
See, I
if
went
that's
through all
your,
that.
Yeah.
but if that's her concern and you wanna avoid that,
I went
don't
through all
think-
that radiation and then it ended up my shoulder.
Mhm.
Right. So it's like I'm not getting any progress.
well, and this won't get rid of the cancer for good.
I don't
That's-
know, it's like,
But from the get-go, they did let you know that it's just, it could come back, it could.
Mhm.
Well,
There was never a guarantee,
No,
Yeah.
not the area.
you know, but it was worth
Well,
the
that's not
fight,
guys, I
and
go
you
get
have
that
fought
bottle
the
of
fight.
liquor.
No.
Well, you wanna say
You know,
goodbye
I
to
wish
them?
you would have a
Yeah.
glass of liquor since
No, I don't need it.
you're not
But
gonna live
I
years.
think-
Let's have that glass of
No, I don't.
liquor.
It's just something you can't change
But I
in
think
a
if,
person.
well, I think your
You
mind
can't
was
even
made
get
up
me
from
to
the
go.
beginning. It sounds like it's
We made
even
her
more
come.
certain now. But
No,
we
it
should
wasn't.
definitely get back in touch with Dana and let them know.
Care.
And, cause I think that's gonna be the most
Well, they
beneficial.
need to bring no bed in my
No,
house.
they're
'cause
not
I got my own
hospice.
bed.
They're not
No.
hospice.
Oh.
But palliative care,
It's
and
not-
it's a,
It's so
it's a
funny.
I got my own
transition to
freaking
it
bed.
when you need it.
I'll go get
Because-
Mike's from his,
and the-
I'll go get
the other-
Mike, I'll go get Mike's
The other
medical
thing with
bed.
hospice is it's for you, but it also is for your
Well,
family.
you might need a
And I
baby.
met your family out there, like.
The big family.
Yes, I mean, they have resources for all your
I know.
family.
They
I
have
bet
good
you that with my
resources.
mother, I
Yeah.
know
They
about
have good
that.
resources.
I mean, so in the,
Yeah.
for now, it's for you and your quality of life,
Mhm.
but then when the time comes, it's for everybody, okay?
Yeah.
So, and I think that will help a lot.
They're in
They're
order.
good people
Yeah.
though. They're good
Oh, yeah.
people. You know, they really
Oh,
are.
I know all about that.
Yeah.
But
But I
there's a
got my own
difference
bed, I
between
don't
palliative
need
Well,
care
you
and
don't have to have a
Yes,
bed
there
like
is.
that. Till
Don't
your
be
bed
making
gets
no
so
beds in mine.
uncomfortable, you might need an air mattress. So hey, don't
Okay,
get
guys, we
out
don't
on
need
you.
to talk about that.
And then
So how
Lori-
has my mom been as a patient?
Huh? She's
Not
been
bad.
fun.
She been
I-
fun,
I-
She
enjoyable?
always keeps me on my toes.
I've made him deals, I've
Made him deals.
I divorced him last
Uh-huh.
time.
Last time, I thought that was in the
And what's
beginning.
the paper?
Yeah.
Give me the paper, this is the final.
Final
Final divorce,
I'm
there's no
talking about
paperwork for that, because you can't get rid of me that easy. So,
Uh-oh.
I mean, right now, if,
Dr. Cook said he was your neighbor, the one that did the spinal tap.
oh, yeah,
He
yeah.
said you had a little dog with him one
Mhm.
time.
Yeah, he's gone running past my house, and my
Yeah.
dog, she
That's
gets up and
crazy.
just starts licking his legs. I'm like, come on, really?
Better than biting.
Yeah.
Yeah.
Like,
I'll
but,
come by
yeah.
and say hi to you.
Okay.
Mhm.
Stop by whenever, call
Now,
whenever.
5 years from now, I'll come by and say hi to you.
I hope that's the case.
Oh, that's quite the
I hope that's your
prophecy.
miracle, okay? So,
Do you believe in them?
you see them every once in a while, okay? But that's why they're miracles. It's really,
Not
you know,
from what you do now, I'm talking about the
Believe?
man's
yeah. Well, and from
Something
what
that
I've seen, yeah.
medicine can't explain. He
Yeah.
sees that, yeah.
Because,
Because
yeah.
I understand you're a doctor, and I believe in you because
Mhm.
he gives you the knowledge to help people and do. See, I know all about it.
Yeah.
And it's not that I don't have faith in you either. But I
Did
just,
she tell you
Well.
she tried marijuana?
No, she didn't.
It
Yeah.
was
you get
not
that
a good
from?
experience. I was not
Yeah.
there.
Yes,
Just so
we
you know.
did.
I
Yes,
was
we
not
did.
there.
but the girls give me,
They gave her too much.
That's
Oh,
not
okay.
natural.
it made my heart race. It made
Yeah.
me never nervous. And the next day I was hungover.
Yeah.
I would never try that
They
stuff.
gave
I didn't
Never.
expect that one.
It was
Yeah.
awful.
I would never try that.
I was the
No.
guinea pig too.
Who did, yeah.
Her
I
and my
don't- I
other
don't even
sister.
wanna
Was
know.
it
don't
an,
even
was it
wanna
an
know.
oil, or was it an
No,
oil?
It's black
It's-
tar and
it's-
stuff.
okay.
It was an oil, right?
Yeah.
And it
An
was in a
oil.
syringe.
A
and
resin or,
Sips and all.
okay.
It looked awful.
No, I would
I
never
mean,
try it.
if you could survive that,
Mhm.
yeah, might help you.
Well, they,
Yeah, but
I mean, it was awful.
I'd rather have chemo or
I'd
radiation.
rather be high for a year. I'd rather be high for a year.
That's for real.
I thought it's supposed to make you feel good. That's part of
Well,
No.
first
No.
time you do get immune to it, I
it
think.
did me.
I'm gonna go hospice where it's.
Yeah,
bad-
Mom, because
bad at
he's
home.
just saying you're gonna start to have symptoms and they're gonna
Well,
help you.
At some point, and then
Right.
they'll tailor what you need based on how you're feeling.
Right.
So if you're feeling like this now, they probably won't have much to do, but if you start to have symptoms, then
Oh,
they can
yeah, I
always,
know.
but you get more benefit out of it, doing it earlier,
Right.
okay? So,
She was pretty nice
Do a lot
lady.
early.
Meeting, like we met her. Remember the
Yeah.
lady? Mom's been to so many appointments. I don't even
Yeah.
know who you're talking.
What lady?
The lady that we talked to when me and Wanda went with you, and she was telling you she would, once you, quit treatment and stuff, she would be there for you to help you with your pain and stuff.
Oh, we went to her.
That
little
one
office.
lady.
Yeah, her
Yeah.
little
Yeah.
office. That's who he's talking
Oh,
about.
that
He's
is
glad
the
that we met her and.
yeah.
She was
See?
really nice. We
Yeah.
liked her.
See, Mom, when you elect not to have radiation and chemo anymore, you really, the only thing they can do is treat you
I know all
symptomatically.
that.
Okay, well,
Yeah.
that's what she's saying.
Well,
so.
and I think, yeah, they should be there, just so you're not having problems and nobody knows about it.
Well,
Okay.
instead of calling them, I'll get that
You
bottle.
kind of be like your doctor, your nurse.
He says I'm crazy that bottle. I might go out of the country. I might go on a big cruise.
Okay.
I might
Where
stay
you-
over there in
Yeah. We go to
Bahamas.
Hawaii.
Bahamas.
Boy, they sell that smoke stuff. They said they have them.
You just told me you didn't like the smoke.
Exactly.
I don't
Yeah,
know.
but there
They
might
say
be
what they
bad.
get for
So,
you.
so she just continues to see her Dr. Platty, right? Her normal
Yeah,
doctor.
well, and
for-
then with palliative care,
and
I
palliative
won't
care.
schedule anything else with me. I mean, I'm
Okay.
one call away, so.
So I guess
Yeah.
we should call
And
Dr.
then I can let
Mackler.
Dr. Mackler know, or if you wanna call him and tell him to. It's up
Well,
to you.
you can, but
Yeah.
I will call the nurse too.
Okay,
I don't want
Yeah.
to see him.
I didn't say you were
I
gonna.
just kidding.
Okay.
He's nice.
but, yeah, I'll let him know, and then if
They
we're
didn't
here if
know.
you need anything.
Tell him that I'm crazy. That cancer is already messing with my brain.
She just wants
I
you
don't think
all
that's the
done,
truth
you
though.
know?
It's there, I don't think it's messing with you.
No more appointments, right, Mom? Is that what you're saying?
I'm gonna go and go to bed.
No more appointments.
Forget about it.
Okay.
Just be like a regular doctor.
But you reconsider,
Hospice.
wanna talk, you know where to get a hold of me.
Okay, I'll go to bed. If I have
I'll go to bed.
I'll agree. I'll think about it, and if I want to see you, I'll call you.
Sounds good.
I am gonna miss you though.
I'll miss you too.
I'm kidding.
Yeah.
I bet
Now she's bull crapping. No, I'm kidding.
I think maybe me, but not so much the appointments.
That's right.
Yeah.
Right.
She likes
Right.
joshing you.
That
Yeah.
I know that.
Josh.
You've been a good
Yeah.
one. You've been a good
Okay.
doctor.
But call me if you need anything.
Okay, I will.
Okay.
You didn't let me sign that divorce paper.
This isn't a divorce paper. This is
I know, I
this is
know.
more like a marriage certificate.
Oh.
This was
Yeah,
the-
yeah, that would be married.
This is more the consent for
Oh, yeah.
radiation. I had this ready too.
Ah, you ain't no good.
Okay.
Believe me.
So.
You tried.